Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
Back pain. We've all been there, or we know someone who has, right? But here's the thing. How do you really know the difference between a simple pulled muscle and something else? Something way more serious? Well, today, we're going to talk about the critical red flags. These are the warning signs that can take what feels like a normal backache and turn it into a flat-out medical emergency.
So, let's just start with the sheer scale of this. A staggering 8 out of 10 people will experience back pain at some point in their life. I mean, think about that. It's practically a universal human experience. But because it's so incredibly common, it makes it really easy to just brush off those rare cases that are genuinely dangerous.
And this right here is the core of the problem. On one side, you've got your benign mechanical pain. You know the kind. You slept wrong or you tried to lift a heavy box and your back screamed at you. It hurts for sure, but it's not a threat. But on the other side, you have pathological pain. And this isn't about your muscles. This is a 5-alarm fire bell from your body signaling something serious is going on, like a tumor, a nasty infection, or even a fracture you didn't know you had.
So that leads us to the big question, right? In a sea of everyday aches and pains, how do doctors become detectives? How do they find that one tiny clue that points to a life or death situation? Well, it all starts by just listening to your story.
You see, the first set of clues, they don't come from a high-tech scan or some complicated lab test. Nope, they come directly from you, from your story, the things you tell your doctor about what's been going on and what you're really feeling.
The first red flag is actually pretty simple. It's your age. If you're younger than 20 or older than 50 and you suddenly get new back pain for the first time, the whole game changes. Statistically, the odds of it being a simple muscle strain plummet, and the risk of something more serious, like a tumor or a fracture, goes way up.
And wow, this quote just drives that point home, doesn't it? This isn't just some abstract idea. This is how clinicians have to think. You take that patient's age, his history of cancer, and this brand new pain, and you have a picture that demands to be investigated immediately. You just can't risk assuming it's a pulled muscle.
Okay, next up, unexplained weight loss. This is a huge one. If you're losing weight and you're not even trying, your body is telling you something. It's a classic sign that something is wrong with your whole system, that maybe a hidden cancer or a chronic infection is burning through your body's resources.
And just look at how these clues start to connect, to tell a story. In this case, the back pain isn't really the problem at all. It's a terrifying symptom. It suggests that a lung cancer, which is common in smokers, might have already spread to the spine. And that unexplained weight loss, that's the key piece of evidence that ties it all together.
Now this one is so logical but so critical. Think about it. Mechanical pain, from your joints and muscles, it feels better when you rest. But what if the pain just doesn't stop? What if it's just as bad or even worse when you're lying perfectly still? Or it wakes you up out of a dead sleep? That is a massive red flag. It's telling you the problem isn't mechanical. It's being fueled by something active inside your body.
And check out the super specific example. The pain is worst in the middle of the night, but it actually gets better once he gets up and starts moving around. That's not a muscle strain. That's the absolute textbook classic description of an inflammatory disease called ankylosing spondylitis. It's a serious condition that needs a totally different kind of doctor.
Okay, we've been talking about clues from your story. Now we're shifting gears. We're moving from subtle clues to full-blown screaming sirens, the kinds of things a doctor might find during a physical exam. And these aren't just hints of a problem, they are alarms for a neurological emergency where every single hour counts.
The first major emergency we have to talk about is something called cauda equina syndrome. So the cauda equina is basically a bundle of nerves at the very bottom of your spinal cord, and they control everything that happens down there, your bladder, your bowels, sexual function. When those nerves get squeezed, it is an absolute time is running out neurosurgical emergency. So the classic telltale sign of cauda equina syndrome is something called saddle anesthesia. And it's a very specific kind of numbness in the exact areas of your body that would touch a saddle if you were riding a horse. So we're talking about the perineum, genitals, and your inner thighs.
And honestly, nothing explains what that numbness feels like better than hearing it straight from a patient. This one sentence, this is one of the most urgent and alarming things a doctor could ever hear. It means those critical nerves are being crushed, and the clock for emergency surgery is ticking fast.
The next emergency sign is a progressive neurological deficit. And the key word here is progressive. It's getting worse over time. We're not talking about a leg that's felt a little weak for years. We're talking about a leg that felt kind of heavy yesterday, is causing you to limp today, and tomorrow you might not be able to lift your foot at all. That is nerve damage happening in real time.
So with all these terrifying possibilities on the table, what's the right move? The answer is actually a simple, non-negotiable rule. You get a diagnosis before you even think about starting treatment. And when these red flags pop up, getting a diagnosis means one thing: an urgent MRI. And this is why jumping the gun is so unbelievably catastrophic. Think about it. If a therapist tries to manipulate a spine that has a hidden tumor, they could literally cause a fracture and paralyze someone. If you start physical therapy on a spinal infection, you can actually help spread it. And for cauda equina syndrome, any delay, any time wasted on a treatment that isn't surgery, it leads to permanent, irreversible damage. So the correct pathway, the only safe pathway, is crystal clear. Step 1. A red flag is identified. That immediately stops every other plan and triggers an urgent MRI. Step 3. That scan confirms what's really going on. And Step 4. The patient is sent immediately to the right specialist, whether that's a surgeon, an oncologist, or an infectious disease expert. It's that simple.
So why are we going through all this? Why is it so important for you to know these red flags? Because understanding this stuff transforms you from just being a passive patient into an active, empowered partner in your own healthcare. If you know these warning signs, you can tell your story more clearly and help advocate for the right move.
And let's end on the most sobering, important takeaway here, because the stakes just couldn't be any higher. This quote says it all. When red flags are present, treating back pain without a definitive diagnosis isn't just a mistake, it's guesswork. And that guesswork can have absolutely devastating consequences.
So the next time you or someone you care about is dealing with really bad back pain, just take a second and ask this question. Is this just a symptom? Just a muscle strain that needs some time to heal? Or is it a message? Is your body sending you an urgent message that something much more serious is going on? Because knowing how to spot the difference, well, it could quite literally save a life.